are very important, so we can touch over the skin. Just please stay there. Review, I will come to you in 5 minutes later and you have exam. This is the costal margin that we can palpate on both sides under the skin. Okay? Please touch over and here. Touch it. Touch it. Yes. This is the costal margin. Xiphoid process, costal margin. Xiphoid and costal margin. And here, again, under the skin, we can touch the inguinal ligament. This is the inguinal ligament. Inguinal ligament. Yes. And this one is pubic tubercle, and this one is anterior superior iliac spine.
This one.
Yes, anterior superior iliac spine, pubic tubercle, and this one is pubic crest. Touch, please. Pubic crest. Yes. Pubic crest. Okay. Now, when we find these landmarks, we try to separate skin at this line, then this line, and at the midline, and circle around the umbilicus. Okay? Because umbilicus is important, and we should keep inside. When we separate the skin, we reach to the superficial fascia. This is the superficial fascia, and at the lower part, as I mentioned, from this line, this made by two layers. This one is scarpa, and this one is camper. Camper, scarpa. Okay? So here, this is the Holden line. Touch, please. Holden line. It's whites of the finger below the inguinal ligament. This one. Holden line.
So it's inside.
Holden line. Holden line is a line that the scarpa firmly attached to latissimus dorsi. Yes?
Yes.
Okay. And the nerves that being superficial here can be like this. Look to this one, this one, and this one. These are, in this line, we have a lot of nerves that being superficial. Some of them appear here, and the others removed. I don't know why. Okay? And here we have lateral. If you find any nerve here, this should be the lateral branch at the mid-axillary line. Yes. Then I made a section through the aponeuros of external oblique. This is the aponeuros of external oblique. I made a cut, and for showing you the muscles here, that this muscle fibers belong to internal oblique. This is the internal oblique. So here, this pancet show you the superficial ring. Please give me that pancet. Yes, yes. Thank you. So this is the superficial ring by two crura, medial crus and lateral crus. As you can see, the pancet, the tip of the pancet is at the orifice that we say superficial ring. Yes. So medial crus, and this one is lateral crus. Between these two, this is the spermatochore that is going to reach to scrotum. This line is show you the course of the spermatochore. So look here, when I made a cut through the aponeuros of external oblique, then we can find two nerves. One of them, both of them pierce this muscle. What was the name
Internal
of it? Internal oblique. Pierce the internal oblique at level of the anterior superior iliac spine. I mean here at this part, okay? And then continuing toward the superficial ring. One of them goes through the superficial ring, this one by a spermatochore, and being superficial here without piercing any part. And the others, this one. This one is iliohypogastric. And as you can see here, please keep this by this. As you can see this is the course of this nerve, iliohypogastric. Iliohypogastric above of the superficial ring pierce the upper nerves of external oblique. This belongs to the upper nerves of external oblique. So, ilioinguinal goes through the superficial ring and being superficial, and this one, iliohypogastric, just pierce the upper nerves of external oblique, and by that becomes superficial. Please, in 2 minutes, review all of this part that I mentioned you, then I will ask you and continue other parts.